Hello, this is Kim McAllister, and welcome to Epidemiology Part 1. Epidemiology is the study of the distribution and determinants of health and disease in human populations. So, in order to know what this means, we have to decide what health is. Originally, the definition of health was the absence of disease. Today, we look at a more comprehensive view when we consider health and consider it to be the whole person. Also, we look at psychological factors and social factors and other things that bring about a state of complete wholeness and complete health. And then disease, we understand what disease is as a state of poor health or a state of some type of illness or problem that has come over the body that needs to be taken care of. So in epidemiology, we study the distribution of disease. So who is having this disease and who is not having the disease? Why is the disease happening? Where is it happening? These are all things that we look at and study to help control and improve the health of the population. So the epidemiological approach includes looking at counts. We look at how many cases. For instance, not long ago there was a measles outbreak at Disneyland. So we would say there were however many cases. Let's say there were 50 cases of measles. That would be a count. Or we could look at events such as a hurricane or some other type of event that caused some type of problem. The epidemiological approach divides. We look at who is sick, who is not sick, where they were sick, what happened. All of these things are divided and cataloged and characterized and analyzed so that we can figure out what is going on. And then we also compare. We look at what did the group of people who are sick do that are not sick, and vice versa, as an example. So when we're identifying something that we're going to examine with the epidemiological approach, we look at and determine the case definition. And this is the operational definition of the disease, how we as those who are studying this disease are going to identify it. And then we turn around and use that case definition in screening and determining who we would determine to be part of that count. So if your work as a nurse, if you have ever asked patients, have you recently traveled overseas? You ask these questions to screen for certain conditions, and these screening questions are part of the case definition. In other words, someone who has, let's say they have Ebola, they have traveled overseas. And if that person says, yes, they've traveled overseas, then you go into more and more in depth of where were you and how long ago did you come back and are you having symptoms and so on and so forth. So this is kind of how we operationalize the case definition. And this helps to identify people with shared causes. So we know that people who had this illness had these things in common, these causes in common. And so we're trying to identify and divide who has those and who doesn't. And all of this is based on the theory of disease causation. So we know that in order to have a disease, you have to have had the causes, been exposed to the causes or been to something with the causes. For example, people who went on a picnic and had food poisoning. The people that ate the egg salad were the people who were sick. So you would find out who ate the egg salad. That would be, what caused, not that the egg salad causes disease, but egg salad often goes, isn't kept at temperature and becomes a problem for people and can make them develop food poisoning. That case definition can change over time. We saw this happen with the HIV epidemic before we really knew what it was. We decided everybody who had this characteristic or had this issue could be people who had it. And then over time, as we began determining, well, this definition didn't really work because some of these people who fell under this definition don't have the disease. And so now we need to modify our definition because we've learned more. And understand that that case definition may not be validated. It can be basically based on a guess. This is our best guess, as we think that this happened because of such and such. And so then over time, as we continue to study and work with people, then we can narrow it down and hopefully identify the cause. So let's talk about how community health nurses use epidemiology to care for the population. First of all, it enhances the clinical decision-making process. If you know things that are threats and problems or potential causes of an illness, it helps you identify the people who are at risk. It also enhances your practice because you understand who can be sick, when they can be sick, what these risks are. It helps you improve your ability to intervene and educate and empower the population so that they're not as ill. It also helps you plan and identify and evaluate. It helps you know what to do to intervene and stop a problem, or how to respond to a problem, because this has happened before perhaps and there is a determined treatment for this disease, or you know where to go for assistance, you know who to report this illness to, you know how to find information from CDC and other sources that will help. So it allows you to not only to educate, empower, and prevent problems, but also to access resources that you need when there is a problem. Epidemiology is an interdisciplinary area of health. It can be used by more than one field. It's not just people who are identified as epidemiologists or just public health workers. It can be used by medicine, physicians, doctors, other providers use this to help guide practice. Nursing, we just talked about how that's used. It's also used by biostatistics, statisticians. My uncle was a biostatistician for CDC for over 35 years and worked in the department that dealt with birth defects. And he was in the research group who studied folic acid. And so he used his biostatistical skills and ability to help compile the data and make determinations of whether or not folic acid would help. And of course, as we now know, it does improve and reduce risk for patients who had a child with a neural tube defect. Laboratory science uses epidemiology in order to test and examine for certain illnesses or disease processes. Social studies will use epidemiology to show how different practices and cultural beliefs and other life ways can impact disease. Policy and politics use epidemiology. Different policies have been developed based on epidemiology. Our practice of universal precautions came about because of the HIV epidemic and all of the information that we learned through epidemiological studies about HIV. Politics is also involved. They will take this information and make major decisions, policy decisions, and pass laws and regulations. So the three main ideas of what we've just discussed were: what is epidemiology, along with key terms. So think a moment for yourself. What is epidemiology? Look back at the key terms that we just discussed and see if you can define those. talk about who uses epidemiology and how they use it, and talk about how nursing uses it. So take a moment to review that and make some notes. And now we'll move on to the next part of our lecture, which is the history and the scope of epidemiology, which is very fascinating to me. We will talk first about Jon Snow, and we're not talking about the Game of Thrones Jon Snow. This is Jon Snow, the anesthesiologist, who used epidemiology to determine the cause of cholera and prevented and stopped the spread of cholera. He made note of the different pump houses in the community and started tracking who was sick and went door to door and asked them which pump house they were using to get their water, and finally was able to identify the source, the pump that was contaminated, and they removed the pump handle from the pump and the cholera epidemic stopped. Florence Nightingale is the first nurse who used epidemiology. She and her nurses arrived at the Crimea, where the Crimean War was being fought, and started caring for the British soldiers. The soldiers were living in tents, and many of the tent that was housing the so-called hospital of the time was set up right next to a cesspool. So there was all sorts of sewage and garbage and foul odors and just foul air in the area where the tent was set up. And many of the soldiers were lying in their own filth. They were wearing the same uniforms and clothing that they were wearing when they were wounded. They had no fresh bandages. They were not clean. They had no way to bathe. And so she began making observations and charts about the condition that they were in when she arrived, and then they began making some changes by moving the hospital to a better location, washing and cleaning the soldiers, giving them clean bedding, giving them fresh air, so on and so forth. And the mortality rate dropped dramatically because of that. And so epidemiology has the ability to have an enormous impact on both mortality and morbidity. The three models, there are several models of epidemiology. The three that we're going to talk about are the epidemiological triangle, the web of causation, and the ecological model. This is the triangle, epidemiologic triangle. And here, it's kind of a two-dimensional approach. You have a host, the environment, the agent, and then the vector. The host would be the person who is ill or the cause, and the agent is the causative factor, and then the environment are the external factors that can contribute or cause illness. So an example of an agent would be an infectious agent like like influenza virus, or some type of physical agent like radiation. The host would be the fact that someone has a genetic predisposition, or it could be an acquired condition. It could be someone who was more susceptible to flu. It could be someone who had been exposed to the radiation. And then the environment would be things like climate or temperature. It could be working conditions. And then the vector is how it's transmitted from the host to the agent, or the environment to the agent, and so on. So this has been a very effective model. Think about some things that are not included in this triangle, such as social determinants and even cellular and molecular issues. Those are talked about in the ecological model that we'll speak about in a moment. Next, we have the web of causation. And the web of causation, you look at a particular problem and then look at the things that contribute to it. And then you end up creating a web. And this is a very basic one that I constructed on factors that contribute to type 2 diabetes. And so those would be limited access to fresh food, lifestyle, lack of education, genetic predisposition. Your limited access to food could lead to poor diet. Poor diet can contribute to type 2 diabetes. And the poor diet and the lifestyle can contribute. Your lifestyle may be sedentary, and so you become obese. And you also become obese because you have a poor diet and because you have limited access to fresh food. And maybe no one's ever taught you about how to live healthy and why you shouldn't be eating all fast food. So you kind of get the idea that this gives you a look at all of the factors that contribute to the problem. And so we can start identifying these issues and start addressing these, and then that can improve the disease state. The ecological model is more three-dimensional. We look at neighborhood and social context, and then also go down to genetic causes and also to the molecular level. So an example of this would be like cancer, where we would look at certain genetic markers like in breast cancer, or certain molecular changes that lead to cancer or other problems, and then looking at the person and then going up to the neighborhood and where people are living, environmental exposures, and other issues. So this is a more comprehensive approach and model. So let's think for a moment about the three main ideas of what we just discussed. How did John Snow and Florence Nightingale use epidemiology? And what impact did it have on the population? For John Snow, it stopped the cholera. For Florence Nightingale, it gave the soldiers a fresh environment. It reduced mortality and morbidity. And then what are the three epidemiological models, which would be the epidemiological triangle, the web of causation, and the ecological model? So take a moment to review those, and then we will move on to the next section.